Thank you. Good afternoon. I'm Cristian Pascual, CEO and co-founder of Mediktor. And my partner, Josep, he is the Business Development Officer. And we are here today to talk to you about Mediktor. And Mediktor is the most advanced and accurate symptom checker for triage, prediagnose, and decision support. So let me start with a question. What did you did the last time you felt symptoms? I can guess some of your responses. You may run to a hospital, schedule an appointment with a physician in 2 weeks, Google your symptoms, call your mother. Well, that doesn't seem really good to me, but don't worry. Studies show that 70% of the decisions we made when we feel bad are wrong. Are wrong because they are unsafe, inconvenient, and more than that, cost a lot of money to the system. So this is the reason why we developed Mediktor. Mediktor is based in artificial intelligence, machine learning techniques, and natural language recognition, so you can just write how you feel in your own words with no medical wording, and the system will drive the interview just like a physician would to give you a list of possible conditions you could be suffering, a level of urgency, and more important, a recommendation on what to do next. So, well, Mediktor is important because for health insurance companies, it's a great gatekeeper of the demand to drive all the patients to the right level of urgency. Today, we will show you a white label integration of our solution with a branch, the Spanish branch of Munich called DKV. And I'm really excited to announce today that today is the launching day in Spain of the Digital Doctor app to 800,000 users. Well, Digital Doctor is a telemedicine platform. It has Mediktor, the symptom checker there, WhatsApp-style interaction with physicians, and a video conferencing tool. And we will now show you how it works. I will leave Josep explaining the solution. I will keep managing the phone.
Thank you, Cristian. So as Cristian said, we're going to show how it exactly works, which is the best way to understand. We've been piloting this solution with DKV in Spain for 6 to 8 months now, and as Cristian mentioned, today is the launch to 800,000 people. So basically, patients access an application completely branded with the look and feel of DKV, and then they can report their symptoms like you see here, back pain and fever. And what you see below is the profile of this patient called Maria. You see the race, the allergies, the risk factors, the medication that the patient is taking, the surgeries that the patient had. And we're also considering things like where that patient is geolocated, the day of the week, the season of the year, the weather, etc. After providing the first symptoms, Mediktor is suggesting other symptoms that based on the experience accumulated after more than 1.5 million consultations in 200 countries in the world, Mediktor is able to detect these other symptoms that most likely this patient will be having. So the patient is answering yes or no, and Mediktor keeps making hypotheses and suggesting other symptoms. The next thing that Mediktor does is conduct a questionnaire which follows the same logic that a doctor would follow, thinking in the same way to get to a final advice. You see that patients have the option to answer yes or no, or maybe yes, maybe no, or I don't know, because sometimes you don't know you have fever and you cannot check that. You have the feeling that you have fever, but you cannot confirm. So after a short questionnaire, which average is no more than 14, 15 questions, and a duration of no more than 3 minutes, the average is 2 minutes, 50-something seconds, we get to the end of the process where Mediktor basically provides 3 things. Number 1 is a recommendation on what to do next. From this is completely banal, you don't have to worry, to we're going to send you an ambulance, and anything in between. Also, the list of conditions that the patient might be having and a description of these conditions and with the level of certainty. And also a full report with all the answers that you provided so that you can share with whoever doctor you want. And more importantly, for DKV, you have access to 3 channels, the call me back, the video call, or the chat, so that at that very precise moment, you can have a conversation with a real doctor who will have received your report and will help you in a couple of more minutes to make the best decision at that moment. So what we have done with this technology is bring patients from a symptom and the uncertainty on what to do next and making wrong decisions and wrong choices and expensive choices to the access to the right gate for care that they need given their precise condition at that moment. And all that happens in less than 5 to 7 minutes. Right. The other thing that we have done, and it's the long-term benefit of Mediktor, is for the first time ever, we're giving health insurance companies the opportunity to gather data in a structured way from the very beginning of the process, where the symptoms appear. This is a moment in the process where no one is gathering data at this point, and we are doing so. If you ask me how many people in Venezuela had fever and back pain last week and were males between 40 and 50 years and ended up with a given diagnosis, I can give you the number. So, again, this is launched today. DKV in Spain is going to be responsible to deploy this technology in the other affiliates of Munich Re and also in other companies to which they provide services. Beyond that, I would also like to say that today we're also presenting for the first time our chatbot version of Mediktor. Last week we launched the version of Mediktor over voice to be used by Alexa and other virtual assistants. And today we're introducing the chatbot version of it. You will see that you can have exactly the same interaction, but just interacting with the technology as a chatbot. So Christian is inputting the same symptoms, back pain and fever, and then it's the technology sending you the questions, and you can interact as if it were a contact in your WhatsApp or in the message system that you are using. With that, I'll give it back to Christian for the final comments and conclusions. Thank you very much.
Mediktor is the most advanced symptom checker. It's a conversational interface based in artificial intelligence, and it's ready to integrate to any kind of interface that you have. It's the only symptom checker in the world clinically validated, with clinical trials proving 91.3% accuracy. And it's the only one available in multiple languages, today fully functional in English, Spanish, Brazilian Portuguese, and before the end of the year in Italian, and in any other language that you want in 4 weeks. So, as you saw, we are ready to integrate Mediktor to any of your digital interface to manage the demand of the health to the right point of care. Please join us to rationalize, in our mission to rationalize access to healthcare worldwide. Thank you very much.